Ozempic, Rybelsus, Wegovy, and Mounjaro. These are the latest 4 medications available on the market. But are they truly effective for weight management without following a proper diet or exercise plan? Are these medications originally intended for weight loss, or are they primarily used to treat diabetes? Weight loss is one of the effects of these drugs. But how exactly do they work? What are the benefits of these medications for the body? Can anyone take these drugs without consulting a doctor? Is it safe to use them without undergoing essential medical tests? What are the possible side effects of these medications, whether they are diabetes treatments or weight loss drugs? There are many important questions to consider before using these medications. It is crucial to be well informed about every aspect to ensure safety and effectiveness. A very important episode. Stay tuned. Peace be upon you. I am Hussein Lutfi, and you are watching the Octopus Pharmacist channel. Welcome to a new episode of From A to Z, Episode Overview. At the beginning of today's episode, I will present the main topics we will discuss. If you are looking for specific information, you can rewind the video by a minute to find the section that starts with the relevant title. However, if you want a complete understanding of these medications, I strongly recommend watching the entire episode from start to finish. As always, let's start with a brief overview to introduce these drugs and gain a simple but clear understanding of how they work. We have discussed this class of medications multiple times before, explaining that they belong to a group called GLP-1, glucagon-like peptide-1 receptor agonists. In previous episodes, we covered medications such as Saxenda and Victoza. You can find links to those episodes in the video description. How does this group of medications work? The key focus today is understanding exactly how these drugs function in the body. GLP-1 is a natural hormone secreted by the walls of the intestine when food starts moving from the stomach into the intestines. At the same time, another hormone called GLP is released, and scientists have developed medications that mimic the effects of this natural hormone. These drugs have several advantages, but the most important ones can be summarized in 4 key points. 1. Regulating blood sugar levels. When GLP-1 reaches the pancreas, it signals that food has entered the intestines and that blood sugar levels will rise. In response, the pancreas releases insulin, which helps lower blood sugar. This makes GLP-1 drugs an effective treatment for type 2 diabetes, as they help maintain blood sugar within normal limits after meals. 2. Reducing glucagon production. GLP-1 also acts on the pancreas to suppress the production of another hormone called glucagon. Glucagon raises blood sugar levels by prompting the liver to produce glucose from non-carbohydrate sources, a process called gluconeogenesis. By blocking glucagon, GLP-1 drugs help prevent excessive sugar production, which is crucial for managing diabetes. 3. Suppressing appetite and supporting weight loss. GLP-1 affects the brain, reducing appetite and helping people eat less. This makes these drugs beneficial not only for diabetics, but also for individuals struggling with obesity. Who benefits the most? Pre-diabetic individuals. These are people at risk of developing diabetes due to excess weight and high blood sugar levels. Taking GLP-1 medications can help regulate their blood sugar and prevent the progression to full-blown diabetes. Type 2 diabetics. These drugs help manage blood sugar levels, reduce abdominal fat, and improve insulin sensitivity, making it easier for the body's existing insulin to work effectively. Overweight individuals. Even those without diabetes can use GLP-1 drugs for weight loss, as they help reduce food intake and promote fat loss. 4. Heart protection. GLP-1 drugs also benefit the heart by protecting the heart walls from damage and reducing the risk of cardiovascular diseases. This effect is not exclusive to GLP-1 drugs. Another class of diabetes medications, called SGLT2 inhibitors, sodium glucose transporter 2 inhibitors, also provides heart protection. Final thoughts. These 4 key advantages have made GLP-1 receptor agonists one of the most important treatments for diabetes and weight management. While there are other benefits to this class of drugs, These are the most significant ones we focus on today. Stay tuned for more insights in the rest of the episode. The second topic, a critical discussion. Some people believe that if they are overweight but have no health problems, or if they have diabetes, they can simply take this medication on their own. Is this true? Absolutely not. Before using these drugs, you must consult a doctor, specifically an endocrinologist, who will carefully assess your condition and monitor for critical factors before and during the treatment. Why is medical supervision essential? Let's go through these important points together. 1. Family history of medullary thyroid carcinoma, MTC. This medication is strictly prohibited for individuals with first-degree relative, parent, sibling, or child who has had medullary thyroid carcinoma, MTC. Why? Studies have shown that this drug group may increase the risk of MTC, a rare type of thyroid cancer linked to certain genetic conditions. If a family member has had this type of tumor, no one in the family should use GLP-1 medications. 2. Symptoms of thyroid inflammation or cancer. If a person starts using these medications and, after 2 or 3 months, experiences symptoms of thyroid inflammation, we must suspect the possibility of a thyroid tumor. Warning signs include O. Difficulty sleeping. O. Trouble swallowing. O. Vomiting. O. Breathing problems. O. A strange sensation or lump around the throat area. Why is this important? O. If a patient experiences these symptoms while taking a GLP-1 medication, they must immediately stop the treatment and consult a doctor. O. As pharmacists or healthcare providers, we must recognize these warning signs, guide the patient correctly, and ensure they seek medical attention without delay. 3. Risk of acute pancreatitis, temporary inflammation of the pancreas. How does this happen? Any medication that stimulates the pancreas to produce more insulin can sometimes trigger acute pancreatitis. What are the symptoms of acute pancreatitis? Severe abdominal pain, sharp, stabbing pain that spreads to the back. Persistent nausea and vomiting, stronger than the usual nausea caused by the medication. Irregular heartbeat or palpitations. Excessive sweating. Fever. What should be done? If these symptoms appear, the patient must stop the medication immediately and go to the hospital. Can they resume the same treatment after recovery? No. Can they try another drug from the same group? Also no. Why? If a person develops pancreatitis due to a GLP-1 medication, they should never use any drug from this group again, because the condition is likely to recur. 4. Severe allergic reaction, skin sensitivity. Some individuals may develop strong allergic reactions to a specific GLP-1 medication, such as Saxenda. If severe skin reaction occurs, the patient must stop the drug and treat the allergy. Can they restart Saxenda? No. Can they switch to another GLP-1 drug? Yes, but only to a different active ingredient from the same group. Why? The risk of cross-allergy between different GLP-1 medications is very low, less than 1%. So switching to another drug from this group is often safe. Final thoughts. Using GLP-1 medications without medical supervision can lead to serious health risks. A doctor must assess your condition, monitor for side effects, and ensure the medication is safe for you. Stay informed and always prioritize your health. Understanding the symptoms and dosing of GLP-1 drugs in diabetes. Today, we will discuss a crucial topic. Are the symptoms of GLP-1 drugs different from the symptoms of diabetes? How do these medications work? And what are their dosing schedules? This discussion is particularly important for doctors and pharmacists who deal with these medications regularly. Let's break it down step by step. 1. Semaglutide GLP-1 drug. Different forms and dosages. Semaglutide is available in multiple forms, including Ozempic injection, Wegovy injection, Rybelsus oral tablet, 1.1 Ozempic injection form, marketed in 0.25 milligrams, 0.5 milligrams, 1 milligram, and 2 milligrams doses. Dosing schedule. Month 1, 0.25 milligrams once a week. Month 2, 0.5 milligrams once a week. Month 3, 1 milligram once a week. Month 4 onward, 2 milligrams once a week. 1.2 Wegovy, injection form. Same active ingredient as Ozempic, but available in higher doses for weight management. Doses: 0.25 milligrams, 0.5 milligrams, 1 milligram, 1.7 milligrams, 2.4 milligrams. Escalated monthly. Eyeges harom Rybelsus, oral tablet. Available in 3 milligrams, 7 milligrams, and 14 milligrams tablets. Dosing schedule: first month, 3 milligrams once daily. After 1 month, increase to 7 milligrams once daily. Maximum dose, 14 milligrams once daily. 2. Why do we start with a low dose? Regardless of the drug form, the first dose is not related to therapeutic effectiveness, but is called a loading dose to help the body adjust. Why is gradual dose escalation necessary? These drugs slow down gastric motility, how fast food moves through the stomach. This delayed digestion helps stabilize blood sugar levels and prevents rapid spikes. However, if high doses are introduced too quickly, it may lead to strong side effects like nausea, vomiting, and bloating. 3. The importance of maximum dosing in weight loss. The appetite-suppressing effect of GLP-1 drugs is strongest at the maximum dose. Some individuals see results with medium doses, e.g., 1 milligram of Ozempic or 7.5 milligrams of Mounjaro. However, according to clinical guidelines, the maximum dose is recommended for optimal appetite suppression. What if a patient cannot tolerate the highest dose? Instead of stopping treatment, the doctor may return to the previous dose for an extra month to allow the body to adjust. If symptoms persist, the patient may need an alternative medication. For GLP-1 drugs and diabetes treatment, are these medications only for weight loss? No, they were initially designed for type 2 diabetes treatment. However, they are now widely used for weight management due to their appetite-suppressing effects. How does a doctor decide the dose for a diabetic patient? Blood sugar analysis. Fasting blood sugar, FBS. Postprandial, after meal, glucose. HbA1c, long-term sugar levels. A diabetic patient may require lower doses, e.g., 0.5 milligrams Ozempic, to avoid hypoglycemia, dangerously low blood sugar. A non-diabetic patient may need higher doses, e.g., 2.4 milligrams Wegovy, for effective weight loss. 5. Switching between GLP-1 drugs. Scenario 1. Switching from Rybelsus oral to Ozempic injection. Step 1. Stop Rybelsus for 24 hours. Step 2. Start Ozempic at 0.5 milligrams, not 0.25 milligrams, since the body is already used to semaglutide. Scenario 2. Switching from Ozempic to Rybelsus. Step 1. Wait 1 week after the last Ozempic injection. Step 2. Start Rybelsus at 3 milligrams per day. 6. Tirzepatide Mounjaro, a new GLP-1/GIP drug. Mounjaro is a newer medication containing tirzepatide, which acts on both GLP-1 and GIP receptors. Available doses: 2.5 milligrams, 5 milligrams, 7.5 milligrams, 10 milligrams, 12.5 milligrams, 15 milligrams. How is it taken? Week 1 to 4. Start at 2.5 milligrams per week. After 1 month, increase to 5 milligrams per week. Gradually increase to 15 milligrams based on tolerance and patient response. Mounjaro for diabetes versus weight loss. For diabetes, dose is adjusted based on blood sugar levels. For weight loss, higher doses, typically 10 to 15 milligrams, provide better appetite control. Conclusion: GLP-1 drugs are used for both diabetes and weight loss, but require careful dosing. Gradual dose escalation is essential to minimize side effects. Switching between drugs requires specific steps to avoid complications. Diabetic patients require different dosing strategies to prevent hypoglycemia. Newer drugs like Mounjaro offer promising results but must be prescribed cautiously. Final advice for patients and pharmacists: never take GLP-1 drugs without medical supervision. Monitor blood sugar levels regularly, especially for diabetic patients. Report any side effects like nausea, vomiting, or stomach pain to your doctor immediately. This knowledge is crucial for both healthcare professionals and patients to ensure safe and effective use of GLP-1 drugs. The fourth and final title in today's episode: 12 Essential Questions about GLP-1 Medications. 1. Can I take GLP-1 medication without diet or exercise? No, this is completely wrong. These medications are not magic solutions. They work best with a healthy diet and exercise. Some people take them without changing their lifestyle, but they often regain weight due to relapses. To get the best results, you should follow a healthy eating plan. Exercise regularly. Even walking helps. Drink enough water. Track your body measurements. Over time, these medications reduce muscle mass, so it's important to eat enough protein and exercise to maintain strength. Remember, this is a temporary treatment, 5 to 6 months. Once you reach your goal, you will stop. If you don't maintain your diet and exercise, your appetite will return and your weight may increase again. 2. How do I know if a treatment is working? To be successful, you should lose at least 4% of your weight within 6 months. Studies show that GLP-1 medications are very effective for weight loss. Some medications help patients lose 11 to 20% of their weight. The latest medication, Mounjaro tirzepatide, has shown up to 39% weight loss. If you don't lose at least 4% of your weight, this medication may not be the right treatment for you. 3. Is this medication the same as insulin? Can it replace insulin? No, this is incorrect. Just because GLP-1 medications are stored in the fridge doesn't mean they are insulin. Type 1 diabetes is treated with insulin, and these medications cannot replace insulin. However, if a type 1 diabetic is overweight, their doctor may add GLP-1 medication to help with weight loss. If this happens, the doctor will adjust the insulin dose, usually reducing it by 50%, because GLP-1 medications enhance insulin's effects. Without reducing insulin doses, there's a risk of dangerously low blood sugar, hypoglycemia. 4. Can children use these medications? Children under 12 years old should not use GLP-1 medications. For children between 12 and 18 years old, the doctor may prescribe them for weight management. For adults over 18, these medications can be used for both diabetes and weight loss. 5. Can I take GLP-1 medication with other medications? Yes, but timing is important. GLP-1 medications slow down digestion, which can affect how other medications are absorbed. To avoid problems, take other medications at least 2 hours before taking GLP-1 medication. This applies to diabetes medications, blood pressure pills, hormonal treatments, and others. 6. What should a pharmacist advise a patient about GLP-1 medications? A pharmacist should focus on 3 key points. 1. Recognizing pancreatitis symptoms. Teach the patient what to watch for and to see a doctor immediately if they occur. 2. Understanding another condition, not specified clearly in the original text, but likely an important warning sign. 3. Managing hypoglycemia. If the patient has diabetes and is taking insulin, they must know how to recognize and treat low blood sugar. 7. Can pregnant or breastfeeding women take these medications? No, they should not use GLP-1 medications. These medications can harm the fetus, so they must be stopped before pregnancy. If a pregnant woman is overweight, she should follow a nutrition plan and exercise instead of taking medications. Breastfeeding mothers should also avoid these medications, as they pass through breast milk and may harm the baby. 8. Where should GLP-1 injections be given? These injections are given under the skin in 3 main areas. 1. Abdomen below the rib cage. 2. Thigh. 3. Back of the arm. Rotate the injection site every week to avoid irritation. 9. How should GLP-1 injections be stored? Before use, store in the refrigerator 2 to 8 degrees Celsius. Do not freeze. After first use, can be kept at room temperature for up to 56 days. Avoid high temperatures like in the kitchen or direct sunlight. 10. What if I forget a dose? If you miss a dose, follow these rules. 1. If you miss a dose by 1 to 3 days, take it as soon as possible, but not too close to your next dose. Example. If you take the medication every Saturday but miss it, you can take it on Sunday, Monday, or Tuesday. But if you forget until Thursday or Friday, skip the dose and wait for your next scheduled injection. 2. If you miss 2 doses in a row, do not restart immediately. Instead, resume your usual dose. If you experience side effects or relapses, you may need to restart at the lowest dose and increase gradually again. 11. When should I take Rybelsus, oral GLP-1 medication? Take on an empty stomach, at least 30 minutes before breakfast. If you forget and eat first, skip the dose and take it the next day. 12. Should I take this medication based on someone else's advice? Absolutely not. Never take GLP-1 medications without medical supervision. Your doctor or pharmacist must check. If the medication is right for you. Your blood tests and health condition. The correct way to take it. These medications can be harmful if used incorrectly. Always get advice from a qualified healthcare professional. I hope this information was useful. If you found it helpful, share, and subscribe for more content. Support the channel on Patreon, PayPal, or YouTube if you'd like to help. Have a great day. Hussein Lotfi.